So you're big on sedation in your practice.
Huge. It's been a big part of our practice. There's a lot of people out there. The studies show a third to half of people have some type of fear of the dentist. So if you think about that, we have patients come in, and there's two reasons why sedation is so great. One is patients, it's a time issue for patients. You think about it, we can do 6 visits or 6 months worth of dentistry in one visit. And
only because what? They're able to tolerate it longer.
Be able to keep open longer, the big thing is the jaw muscles. If you're awake and your jaw muscles are there trying to hold your mouth open, you're going to remember that, and the brain does a funny thing. It's going to remember that, and it's going to tighten up like a cramp. If we can get that done while they're asleep and everything's relaxed, much, much better, right? They don't remember that. They don't have those same issues of soreness. Okay?
So for the dental phobics, or even for the busy person, sedation just allows you to do more in a shorter period of time.
So phobics, we find that these are people that have been holding back. They haven't come to the dentist, and so they find us. And here's the thing with that phobia is costing them thousands of dollars. It's things are getting worse and worse year after year, but they don't want to come in and take care of those issues because they don't want to be in pain. They don't want to, the whole someone in your mouth right there in your face, numbing you up. You're going through all those steps, holding my mouth open for all this period of time, for a long period of time. They don't want to go through all that. So we can get them asleep. They come to, and they're asking us if we started yet, and we're done. We finished.
Now, is this true that in certain cases, if somebody's really afraid of the dentist or phobic, you give them a pill the night before, just to sleep?
There's an option there. So that helps with in conjunction with their sedation. If we give them a pill during the procedure or for the procedure on day of, it's not as predictable as something like IV sedation. And that's why I'm also a big believer in the IV sedation. It can predictably, that medication is in and out of the patient 5 to 15 minutes. And
so you can pull them out of it as well, right?
Very quickly.
With sedation.
Yeah. And again, like we talked about, they're not in a deep, they're not in a hospital type sedation. They can cough on their own. They're breathing on their own. We're monitoring all of that as they go through that process. And again, we're doing it according to their metabolism. And that's the thing, we can check and monitor throughout that process.